And we're very pleased to welcome back to Telile 24/7, the Health Care Recruitment Navigator for the Cape Breton South Recruiting for Health Committee. She is Maggie MacDonald. She joins us from her home office in Port Hood. Maggie, thank you very much for coming back and joining us again today.
Hi, Adam. Yeah, thanks for having me.
No trouble at all. And it's been a busy time for you and your office and for your committee over the last couple of weeks. So let's begin with one of the big reasons that I did want to talk to you today is that your committee, Cape Breton South Recruiting for Health, has confirmed the arrival of a new physician. Dr. Tebechi Okeke is going to be joining the Island Gateway Medical Clinic here in Port Hawkesbury. Can you give us a little sense about how that all came together, what his background is, and just how he's going to fit into the local healthcare system?
So Dr. Okeke will be joining the rest of the healthcare team at the Island Gateway Clinic in Port Hawkesbury. And so he'll practice as a family doctor. So he has been a family physician. He graduated in the college or the University of Nigeria and has participated in the Nova Scotia Practice Ready Assessment Program to have his credentials moved to be able to practice here in Nova Scotia. So he'll set up his own practice as a family physician in Port Hawkesbury. He does have some interest in inpatient care in the future, possibly at the Strait Richmond Hospital. And I think he plans to shadow Dr. Collins a little bit in the long-term care facilities that Dr. Collins has overseen for many years now. So he begins actually his practice in Port Hawkesbury today, March 15th. And we can expect him to be another valuable asset to our healthcare team in this area.
Now, part of your job, obviously, is selling potential new physicians and new nurse practitioners and such on Port Hawkesbury and the Strait area as a region, not only as a place to be doing medical work, but also as a place where those who have families can bring their families. And we do understand that Dr. Okeke is married with young children. I just wonder, what do you think sold him on this area?
So Dr. Okeke was fortunate enough to tour the area last January before I came on. But while he was still in the Nova Scotia Practice Ready Assessment Program. So him and 5 other physicians got the opportunity to visit Port Hawkesbury and the Strait Richmond Hospital and participated in what I'm told was one of the best site visits ever in Nova Scotia Health. So that's good news. So when they were here, they were able to visit the town, see what we have to offer. They loved the waterfront. So they got a tour of the civic center, the school systems. They were able to see all the amenities Port Hawkesbury had to offer, all in close proximity to the clinics we have here and the hospital as well. So for Dr. Okeke, he does have a young family, 4 boys, who are very much into sports, I'm told. So he was really impressed with the services and recreational opportunities in the town.
I want to ask you, Maggie, now, this is coming at a time where there's also been a departure in a GP from our local area. Dr. Stephen DeRoche leaving the Arishat Medical Clinic in late February. Is there anything you can tell me, even in terms of just the general feeling with your committee, knowing that you've been successful in bringing one physician in, but that another physician is leaving in the general area as well?
From a community point of view, I can't speak towards the direct impact this may have for some of Dr. DeRoche's patients he was seeing at the Arishat Medical Clinic. But it's great we have a new family physician in the area, and it's also great that we have a physician now doing full-time hospitalist care. But it creates that little bit of shift. So there is a gap, where there will be need. So I think the hope is that Dr. DeRoche's patients would have registered with the province's registration for those who need a family practice. And so when we do have somebody new in the area, like Dr. Okeke, some of them may be able to get onto that roster once he's accepting new patients. I can't confirm or anything like that, but it's the hope.
All right. Well, we'll certainly hope for the best as well, too.
Yeah.
How does your committee look at dealing with a sudden departure like this? And is this the sort of thing where you leave it to the Nova Scotia Health Authority or you work directly with them? What happens, or what in the terms of your position as healthcare recruitment navigator happens when you do have a departure of a doctor? Does that ramp up the intensity for your office, or is it more of a collaborative approach with the health authority?
That's a great question. So it is a collaborative approach. So right now, Nova Scotia health representatives would be in discussions with the folks at the Ayrshire Clinic to probably work on a future job posting for another family physician there. So I can't speak on, negotiations or anything like that.
Sure.
But I know us as a group, we've been in touch and we keep very close communications with the physicians and the staff at the Ayrshire Clinic. So when this was announced that he would be transitioning to the hospital, Dr. DeRoche, they had reached out to us and let us know. So what that might look like from where I stand is a little bit of a ramp up in our efforts. So that may look like playing a stronger role. So Ayrshire Clinic is fortunate enough because both the Dr. McNeils are teaching physicians. So they do see a lot of residents and medical learners pass through their office. So from our community's point of view, that might look like us jumping in and helping host more physicians or more students, hosting retreats on weekends just to have medical learners kind of pass through these communities and gain a better understanding of what we have to offer, hoping that one might be interested in staying in the area.
All right. We'll hope for the best in that regard. Another recent success that your Cape Breton South Recruiting for Health Committee has had in recent weeks has been the arrival of 2 locum doctors from Ontario, who we've seen everywhere from the individual clinics to pulling hours at the Straight Richmond Hospital in Evanston as well, too. And looking just a little farther afield down the road, they've been doing some work at St. Martha's Regional Hospital in Antigonish as well. Can you give me an update on what exactly is happening with those 2 locum doctors and how that situation turned out?
So we did have 2 locums come and do some shifts at the Straight Richmond Hospital, probably around Christmas time. While one has returned home, so he did a little tour of Guysborough and our area and down towards Bedeck and really enjoyed his time here. He has gone home for some family matters, but does plan to return hopefully this spring to the area. Just to do some more locuming. So while the second one is still residing in Antigonish, actually, with his family, and he's really enjoying himself doing these locum shifts between St. Martha's, Guysborough, and the Straight Richmond hospitals. So locums are a huge asset to the healthcare system because they provide coverage for time off for other physicians, and they can fill in the gaps where hospitals might be short, like in an emergency department. So we hope to see more locums come through this area as well in the future.
All right. We'll hope for the best in that regard, and good to hear of a return for one of those locums as well, too, a little later in the spring. Maggie, I was curious about what the next steps are for the Cape Breton South Recruiting for Health Committee, and that may seem like a purely academic question because your next step is to go and look for more doctors. But can you give us a sense of what the process is for you at this exact point in time? What are you and your office really concentrating on at this point?
So like you said, Adam, we do plan to continue on what we're doing now. So supporting the healthcare professionals we have in the area as best we can, while continuing to showcase our region. So we do have a rural and remote conference coming up this spring. So it's an online conference for rural physicians. So they can be medical students and learners, residents, or already practicing physicians who all have an interest in rural medicine. So we will be attending that to showcase our region and all of the opportunities we have to offer here. A lot of our future work too, I see being done in community. So we will be getting into the classroom settings. So possibly the CCAs and LPNs or RNs at State of X, and just presenting on what our committee does, why we came together, how we can support them, but more importantly, hearing their feedback. So what I'd like to see done is is more surveys in the community, surveys put out to students in healthcare and practicing physicians to really dive in and see where the needs are and what can be done from a community side of things. So from being in this role for over 6 months now, I see kind of a trend. So from recruiting within your own communities. So it's known as growing your own, and it works. So it's just to say that students and professionals who grow up here and are familiar with the area and the rural living, I guess, are more likely to return and stay long term. So in the future, I think you'll see more initiatives targeted towards that.
Well, I am curious about one aspect of bringing medical professionals in, Maggie, whether they're homegrown or whether they're coming from outside the community, and that's the issue of housing. I know that you and your colleague Trevor Boudreau presented recently to Richmond Municipal Council's Committee of the Whole, and at that meeting, Warden Amanda Mumbercat asked you to specifically address the issue of housing for new physicians to this area. Can you speak to that for a moment and just tell us where the gaps are and why that's a concern for your committee?
Yeah, definitely. So I can say that housing is probably our number one challenge and a huge barrier, not only here, but all over Nova Scotia. So I meet with other navigators across the province, and we all have the exact same issues. So, and which is just, it comes down to the lack of housing options, specifically for rentals. So Airbnbs are very popular in this area and can be a wonderful option for short-term rentals, but only during those winter months. So, from June to September, that peak season, they're rented by the week or on weekends. So if we don't have long-term solutions for not only healthcare professionals, but for people in general, moving back home or moving to a new place, we just can't retain them no matter the efforts. If they don't have a place to live, they can't stay. So something neat that another navigator kind of was part of in Yarmouth was she's employed by the Chamber of Commerce. So their Chamber of Commerce partnered with their local credit union and created a model. So they called it their Medical Learner Housing Project. So they were able to join together and figure out the wants of these medical learners, their need for housing, and they were able to build units very close to the hospital for medical learners. So it's just it's no stress. You're not looking for, okay, whose Airbnbs are available. I have 6 students coming, and now it's just a place for them to stay, and it's easy, and it fixed the issue. So maybe in the future we'll be lucky enough to have something like this in this region.
We'll wrap up with a question that connects to the previous one in terms of your presentation to Richmond Municipal Council. And I know that you folks have been very active in working with the member municipalities of this region. Port Hawkesbury Town Council has worked closely with you as well. Can you talk about how important that is to have the municipal councils on board and to be working in tandem with them in terms of not only bringing potential doctors to our area, but also showing them around and really doing a selling job to make it clear that this could be a good fit for them?
Yeah, absolutely. So our group does have a strong presence of municipal counselors, sorry. So they join our meetings and they provide us with valuable feedback from a community point of view. And they're all interested in the overall success of our initiatives. So they're all strong community leaders, and we all want to see more healthcare workers be employed in this area. So their presence is extremely important on our committee. I can definitely say both Richmond County Council and the Town Council are huge support systems to my role. So whether we're doing, like you said, a site visit, they're the first ones to volunteer, and they know what's popular, they know their towns, and they know what's going to showcase them the best. So it's really important to have them be a part of this. All of the work they are doing within their own councils, aside from helping me in my role, whether it's housing projects or beautification efforts, economic development strategies, all of that is going to make Cape Breton South a more attractive place to live for everybody.
Well, we've covered a lot of ground in a short time, as I expected we would, Maggie, and I appreciate that very much. Did you want to add anything else about the process before we wrap up here?
I don't think so. You covered a lot of great questions. The only thing I will add is since we kind of announced Dr. Okeke's arrival, I think everybody's had a lot of inquiries about getting family physicians. So I just want to say to the community about the importance of registering with the province for needing a family physician. Make sure you get your name on that list if you are in need of a family practice.
All right. Well, we know that yours is a busy job and a very important job for our area. We appreciate you taking some time to help talk about all of these issues with us. Thanks so much, Maggie, for joining us once again on Telile 24/7.
Thanks, Adam.
Maggie MacDonald is the Health Care Recruitment Navigator for the Cape Breton South Recruiting for Health Committee. We've been speaking to her via Zoom from her office in Port Hood.